Hello everyone! Are you currently taking blood pressure medication? Or have you recently been diagnosed with hypertension? After watching this video, your thoughts about blood pressure medication will completely change. A university hospital conducted a 10-year study tracking 1,200 hypertensive patients aged 65 and older, and the results were shocking. The difference between those who consistently took their medication as prescribed and those who stopped on their own is truly astonishing. I'll reveal the results in the second half of the video, but what's even more surprising is that 7 out of 10 people taking blood pressure medication don't know exactly how long they need to keep taking it. Some even mistakenly believe that if their blood pressure returns to normal, they can stop the medication. Today, I'll share crucial information how long you really need to take blood pressure medication, what actually happens if you stop, and the hidden truths about blood pressure medication that doctors don't always explain. If you don't want to miss out on this important health information, please subscribe and turn on notifications right now. If you find this video helpful, please hit the like button so more people can see it. Hypertension rates increase dramatically after age 50, and by the time people reach their 70s, more than half are hypertensive. Yet, most patients don't fully understand their own situation. First, here's a shocking fact: 85% of patients who stop their blood pressure medication on their own see their blood pressure rise even higher than before within 6 months. Even more alarming, 30% of these patients experience life-threatening complications such as stroke or heart attack. So, do you really have to take blood pressure medication for life? Or can you stop at some point? To answer this clearly, let's start by understanding what hypertension is. Hypertension is a condition where the pressure on your blood vessel walls is consistently high. It's diagnosed when your systolic blood pressure is 140 or higher, or your diastolic blood pressure is 90 milliators or higher. Recently, stricter standards have been adopted, and some now consider 130/80 mmHg or higher as hypertension. Why is hypertension dangerous? High blood pressure forces your heart to work harder to pump blood, putting strain on your heart and damaging your blood vessels. Over time, this damage can lead to serious complications such as heart attack, stroke, and kidney disease. That's why hypertension is often called the silent killer. Now, let's answer the key question: how long do you need to take blood pressure medication? The answer is more complicated than you might think, because it depends on the cause of your hypertension and your individual situation. Hypertension is broadly divided into two types: primary, essential hypertension, and secondary hypertension. Primary hypertension has no specific cause and accounts for over 90% of all cases. It's influenced by genetic factors, age, and lifestyle. Secondary hypertension is caused by other diseases or medications. In these cases, treating the underlying disease or stopping the causative medication can return blood pressure to normal. For example, if hypertension is caused by kidney disease, treating the kidney issue can lower blood pressure and medication may no longer be needed. But here's an important fact for primary hypertension: most patients need lifelong medication. This is because hypertension is a chronic condition to be managed, not cured, just as diabetes patients need insulin for life. There's a common misconception: many people think that if their blood pressure is normal while taking medication, their hypertension is cured. But the medication is only controlling your blood pressure. If you stop, it usually rises again. It's like wearing glasses: you only see clearly while you're wearing them. Research shows that over 80% of patients who stop their medication see their blood pressure rise again within 6 months. If you stop suddenly, a rebound effect can cause your blood pressure to rise even higher than before, which is very dangerous. So, who might be able to reduce or stop their medication? Mainly those with mild stage 1 hypertension who have a clear lifestyle-related cause such as obesity, alcohol, or smoking, and who have corrected these habits and maintained normal blood pressure for over a year. Even then, this should only be done under strict medical supervision. Second, you should have no other cardiovascular risk factors. If you have diabetes, high cholesterol, or smoke, it's safer to continue medication. Third, your lifestyle must be sufficiently improved. Weight loss, regular exercise, quitting smoking, limiting alcohol, and reducing salt intake must come first. But even if you meet all these conditions, you should never stop your medication without your doctor's guidance. Medication should only be stopped gradually and under medical supervision. Now, let's reveal the shocking study results I mentioned earlier. A university hospital tracked 1,200 hypertensive patients age 65 and older for 10 years. The group that consistently took their medication had a 23% lower risk of stroke and a 31% lower risk of heart attack. In contrast, those who stopped their medication on their own had a 1.8 times higher risk of complications. If you try to stop your medication, it should be done step by step. First, gradually reduce the dose while monitoring your blood pressure. During this process, check your blood pressure more often and visit your doctor regularly. If your blood pressure rises, you may need to go back to your previous dose. Lifestyle changes are also crucial. Losing 1 kilo of weight can lower systolic blood pressure by about 1 mm². Regular aerobic exercise can lower blood pressure by 5 to 10 mm². Reducing salt intake is also effective. Keeping sodium under 2.3 g per day can lower blood pressure by 2 to 8 mmHg. Quitting smoking and limiting alcohol are important too. Smoking constricts blood vessels and raises blood pressure, and excessive drinking can also increase it. Managing stress is also necessary, as chronic stress activates the sympathetic nervous system and raises blood pressure. However, lifestyle changes alone have limits. If you have strong genetic factors or are older, you may still need medication even with lifestyle improvements. What about young people with hypertension? If you're diagnosed in your 20s or 30s, treatment is even more important because the risk of long-term vascular damage is higher, but lifestyle changes can also be more effective at a younger age, so you may be able to reduce your dependence on medication with systematic management. Pregnancy-induced hypertension is a special case. High blood pressure during pregnancy often returns to normal after delivery, but women who have had pregnancy-induced hypertension are at higher risk of developing chronic hypertension later, so ongoing monitoring is needed. Many people worry about side effects. Common side effects of blood pressure medication include dizziness, cough, swelling, and fatigue. But most side effects can be improved by changing the medication or adjusting the dose. Never stop your medication because of side effects. Always consult your doctor for alternatives. Recently, many types of blood pressure medication have been developed, allowing for personalized treatment. ACE inhibitors, ARBs, calcium channel blockers, diuretics, and beta blockers are available, so your doctor can choose the best option for your condition. Monitoring your blood pressure at home is also important. Regular self-measurement in the morning and evening with records is very helpful for your doctor in planning your treatment. Many people feel burdened by the idea of taking medication for life, but think of it this way. Blood pressure medication is like life insurance that prevents heart attacks and strokes. A small daily effort can prevent major risks. Medical advances may also bring better treatments in the future. Gene therapy, stem cell therapy, and personalized medicine are being researched, and new, more effective treatments with fewer side effects may be developed. Here's an important tip. Many people miss the importance of timing. When taking their medication, most blood pressure medications are best taken in the morning, but recent research suggests that taking them at night may have greater cardiovascular benefits for some people. However, this is not yet standard for everyone, so always consult your doctor before changing your medication schedule. Also, be aware of drug interactions. Some medications and supplements should not be taken with blood pressure medication. Always tell your doctor or pharmacist about all the medications you're taking before starting a new one. Now let's talk about common mistakes. First, don't stop your medication just because your blood pressure is normal. As I said, the medication is controlling your blood pressure, it's not a cure. Second, don't refuse medication because you're afraid of side effects. Most side effects can be managed, and the risks of untreated hypertension are much greater. Third, don't take your medication irregularly. Take it at the same time every day for maximum effectiveness. Skipping doses or changing times can make your blood pressure unstable. Fourth, don't replace your medication with folk remedies or supplements. These may help a little, but they can't replace medication. Fifth, don't neglect regular checkups. Even if you're taking medication, you need regular tests to monitor its effectiveness and check for side effects. Finally, here's some practical advice. You don't have to change your whole lifestyle overnight. Start with small steps. First, take your medication regularly. Set an alarm or use a pill box so you don't forget. Add blood pressure-friendly foods to your diet, such as bananas, tomatoes, and spinach, and gradually reduce your salt intake. Regular exercise is important too. Start with 10 minutes of walking a day and gradually increase. Don't push yourself, just do what you can. Buy a home blood pressure monitor and check your blood pressure regularly. Keeping records is useful for your doctor. If cost is a concern, talk to your doctor about generic medications. Generics are approved by health authorities to have the same active ingredients and effects as brand-name drugs, so you can use them with confidence while saving money. In conclusion, most people with hypertension need lifelong medication, but this isn't a reason for despair. With proper treatment, you can maintain a healthy life and prevent serious complications. The key is to work closely with your doctor and manage your condition consistently. If you're considering stopping your medication, always consult your doctor. Your blood pressure, other health conditions, family history, and lifestyle should all be considered before making a decision. Combining medication with lifestyle changes will give you the best results. Managing hypertension is like running a marathon. It requires steady, long-term effort. Don't feel burdened by taking medication. Think of it as an investment in your future health. Regular checkups, consistent medication, and healthy habits will help you live well with hypertension. If you're watching this and think, I need to manage my blood pressure, better leave a comment saying blood pressure challenge. If you have questions about other health topics such as diabetes, cholesterol, or heart health, leave a comment and let me know. I'll cover those topics in detail. If you found this video helpful, please like and subscribe and share it with anyone interested in health. I wish you all a healthy life. Thank you.